We're going to get started.
They look very young. Very young. Thank you.
Actually, so we're going to get started. I am Val Arnaud-Pelche, and I am the Aboriginal Coordinator with the College of Medicine and the School of Physical Therapy. And I'm here to introduce our guest speaker today. So first of all, I want to acknowledge the traditional territory that we're on. This is Treaty 6 territory and the homeland of my ancestors, actually, as well as the homeland for the Métis people of this province. So, WebEx, do we have people joining us?
Online, but we just want to let everybody know that we're recording
Okay.
The talk, and so people are joining on via WebEx from elsewhere in the province, and then depending on whether it's okay with Holly, we'll likely upload the talk to our website after.
I don't know if everybody heard that, but we're being joined by WebEx by some other communities and some other people, so be careful what you say. So Holly is a good friend of mine, and she's a member of the Thunderchild First Nation. She's worked as a registered nurse in a variety of northern communities, in addition to various other healthcare environments, since 1985, and she still looks like a spring chicken. Holly's an assistant professor in the College of Nursing at the University here of Saskatchewan. She maintains an active practice as a registered doctoral psychologist, working primarily with individuals who have experienced trauma and symptoms of post-traumatic stress disorder. Holly's research is focused on Indigenous health, mental health, and well-being. So, welcome, Holly. Thank you for joining us today.
Thank you. I have thank you. Yeah.
I'm going to also offer her some traditional tobacco. It's a form of reciprocity for the knowledge that she's going to share with us today. So thank you.
Hi. Thank you. Well, thank you everyone for coming. I know that everyone's schedule is so busy. And as I was preparing the talk for today, I was thinking there's so many things I could talk about with resilience. And I went to the one that was offered on campus for our students and faculty, just to see what's being said there. And I often attend conferences and looking at mental health and wellness. And I was talking about with Val, and we were talking about the Cree word, and with indigenization and looking at other worldviews, and particularly looking at language. And I spent a bit of this morning talking with a Cree speaker from my community. And we were talking about how to say, first of all, I wanted to make sure I said it correctly. It's ahkameyimok. And he said it's about everyone helping everyone. Keep encouraging each other, don't give up, and keep going. And I really like the Cree cultural of the language because it implies we all have a responsibility to support each other. Whereas when we look at resilience from a Western paradigm, it's very much of what can I do from my perspective right here and now. So there's very much a blend of both cultures, and looking certainly, we can't talk about resilience without talking about past experience. We can't talk about resilience without talking about how we manage and how we cope. But most importantly, when we look at the Saskatchewan context, so some of you are students, graduate students, some of you in medicine, many nurses here as well, is we provide care for people. So what I'm hoping is that you'll take from this as a personal construct of how you can enhance and improve your resilience. You'll find that most of what I'm saying is not new, but I'm hoping that it's organized in a way that you can say, yes, I'm very good at this, I'm 10 out of 10. And I've been doing a survey with family members and people I know. I've been asking themselves to rate themselves 10 out of 10. So I'll let you do that when we get there. And it was very interesting. Many individuals, they rate themselves 6 in some areas, 9 in that. So we all have areas that we're doing really well, or we wouldn't be where we are. But we all have areas that we can improve and work on. So I think it's really important that we have a construct to look at what is it that will make a difference when I'm experiencing a particularly challenging time in my life, and what can I do more of? But then on the other side, when we look as healthcare professionals, what does that mean? It's about having that context or that lens in which we view people who come into our care and understanding how their past experiences has or may have impacted them when they come into our care. So I always like to start with a little bit of context of where I come from and kind of my family. So this is a picture of my mother and my auntie's taken in my community, Thunderchild, Beasuawasis, at a Sundance. So my mother is on the far left, on the far left and whatnot. So I was fortunate to have been raised, exposed to my culture and immersed, and very active with Sundances. I show this picture because we're talking about resilience, right? This is my daughter. How many of you are parents? A few of us in here. And how many of you have nightmares of your children growing up and joining the circus? Never occurred to me that that would be what my daughter would do, but that's what she has done and is doing. She went to Dal and she finished a degree in English, and she's fluent in 3 languages, in French, German, and in English. I also show her picture for a reason. If we can't tell who people are, what their experiences are by looking at them, and by looking at her, you cannot tell that her grandmother was in the residential school, and that her mother, was directly impacted by that legacy, and so has she been. And that. So a lot of assumptions we make about people when we look at resilient, and sometimes we look at people and we say, oh, doesn't matter what happens, they just keep going and doing it. It seems like nothing bothers them. And we look at other people and we're just thinking, oh, they're not coping very well. So we tend to make lots of judges and assumptions. And I want to talk a little bit more about when that's helpful and not helpful. It's a bit of a kind of a standing joke between us because both my kids are more into the arts, and that one function there, I'm trying to get that didn't work, where she's upside down. She's at a corporate function pouring champagne. She makes $200 every 30 minutes. And so she kind of says, Mom, I don't think you should complain with what I'm doing. And she loves what she's doing. We talk about resilience, we talk about support. And I'd like you to think about, as I'm going through some of the content here, is where do you get your support? Where do you get it internally, and where do you get it externally? And one of my main ways is my connection with nature, plants, and animals. And these are 2 of my closest companions, Odin and Shiloh. So we're talking about resilience. So what we're really talking about is how do you cope with life when you feel like you're always running, right? How do we get stronger? How do we sleep better so we can evade him, the saber-toothed tiger, and that? So I'd like you to think about, even though we're talking about resilience and we're talking about our own wellness and we're talking about ways that we can do things better and be more efficient, and when we particularly start talking about trauma, it's important that we look from a context that takes both paradigms into perspective, not just the one who's coping and struggling and trying, but the forces that are being applied to the person that are compromising their wellness. So I wanted to start, and I spoke with this Cree speaker. So that's the English phonetics, if you were to say it, ahkameyimok. And the way I said it to him, he says, the way you're saying it's plural. And when you say it in a plural form, that's where it's everybody encouraging each other, everyone to keep going, and remind each other to keep going. So they talk about like a strong mind, ahkameyimok, and that. So that's where that comes from, is that that's a collective response we can have with supporting each other. And so today what we're going to talk about, I thought, how can I kind of coin this a little different, who, what, where, when, why, how, look at a reporter kind of perspective to make it brief and succinct and that. So we're going to look at it within those categories. So really what, we're going to a definition of what we're talking about, who, why, where, and when. Semak, that means right now, and Cree. That's when do we start addressing and looking at enhancing our resilience. It's right here, right now. We don't have to wait. And a little bit of the how, how do we do this in the light of the very complicated fabric and context that every Canadian lives in. And the first, I always believe, is having the understanding, the knowledge of what is resilience. Like, how do we know what it is when we're doing it? And what do we do if it doesn't work with what we're doing? And the really good news about everything I'm going to talk about today, because there's going to be a little bit of the part that we often try to avoid or don't want to talk about when I talk about trauma, is that resilience is something you're not born with. It's not something you're born with or not born with. It's a trait. It is a behavior, thought, things that we can teach, and everyone can learn this. So that's the really good news, is that everyone in this room and everyone we know can enhance and improve their resilience. So that's the really good news, and I'd like you to hang on to that. We're going to talk a little bit about the past impact of adverse childhood experiences, and that more than likely has impacted everyone in this room. and a little bit about colonization, and specifically because of the Saskatchewan context, and also to frame it within the TRC calls to action. We all have a responsibility to look at those specific recommendations, and so it's important that we understand how the past has impacted the development of this and what that means in our practice as professionals, in whatever degree that you're going to be practicing within. So we look at what's resilience. There's many definitions, but the easiest way to describe it is ability to bounce back. Now, I don't really like that because I think of a ball. When you throw a ball and you hit the wall and it bounces back, because it doesn't feel like that when you're in the midst of having, something have happened to you. And so, but when we look at it, it's just ability to return to how we can go back to our life as it is. Life is never really the same when you've had something traumatic, or say you've had a major surgery or a major loss, but it's getting back into the swing of being able to enjoy life. I think that would be the most simple way to put it. And just because someone's resilient, it doesn't mean that they do not experience emotional discomfort. In fact, the opposite is true. People who tend to cope well and recover faster do it because they actually go to the root. They deal with the issue. So usually I have a mountain, and I forgot to put it in this slide. And if you imagine when we have something uncomfortable in our life, it could be the grief related to a loss of a family, loved friend, or it could be another event that's happened in our life. If you look at the mountain, what we tend to do when we don't know how, we're uncomfortable, we don't have a skill set or a toolbox to help us, is we go around the mountain. That's called avoidance. And so that's really what many of us do till we can figure out a way how to deal with the root of the mountain. But when we look at the research and we look at people who recover the fastest, they're the ones who go to the mountain. They go to the root. So we can, in psychology, we call that desensitization, we call it exposure. We have a number of names for it. And we can go there in different ways. We can go there individually, say perhaps we have skills, we've been there before, we know what we have to do. Perhaps we need professional assistance, a psychologist, a counselor. Perhaps we go with an elder, or perhaps we use tradition, we use sweats or sundances. We go there with a collective community of support. There's many different ways we can go to that root of that mountain. So I want to just leave that with you, that there's not just one way. There's a multitude of ways. So the really good news of everything I'm going to say is that you can learn it and you can enhance what you're doing. So that is the fabulous news. The other thing is I'd like you to think about your fire, iskito, and create iskito as fire, and iskwewak women, so meaning women have the fire, because they can create life, bring life. I want you to think about, when I was doing research in my community, we were looking at suicide and looking at what can we do. And what we did was we did assist training for everyone 16 and over in the high school. But we met with the elders, and they said, we don't like that word suicide. We prefer a word that is talking about the fire, because when people start thinking those negative thoughts of not wanting to be here, it's more about their thinking the flames are getting low. So we'd rather think about iskito, fire. How can we feed the fire? How can we fan the fire? How can we support the fire? So I want you to think about that as we're talking resilience. What do you do that supports and fans your fire, iskito, the fire of life, fire of your soul? There's many chi, many different ways we can refer to this life force and that. So no surprises when you look at this. So we're just going to give you all the answers right at the beginning. This comes from the American Psychological Association as to what makes a difference. And I'd like you to think in your mind, or write a piece of paper, just rate. If you were to rate how caring and supportive your relationships are inside your family and outside your family, how would you rate inside your family out of 10? And outside your family could be agencies, colleagues, anyone that is not related to you. Now that's kind of hard when you agree, because we talk about Wakoto and we're all related, but let's use kind of the nuclear family as a definition. So put yourself and think, you don't have to write it down. And then when you look at these relationships that are loving and supportive and have role modeling and offer us encouragement, how would you rate that? The third one is the capacity to make realistic plans and take steps to carry them out. This is really critical, because when we have a crisis in our life, we feel that, what am I going to do? I don't know how to move forward. I don't even know what step to take right now because I'm so overwhelmed. So the quicker we can get to making a plan, and usually it doesn't happen in isolations. You do have experiences where you go to bed at night. You ever go to bed at night and you're really thinking about a problem or an event that's happened and you're wondering about how to solve it, and you wake up in the morning and you have an answer? Does it happen to you? Yeah, it does happen. That's great what happens when you go to sleep. So that can happen. But if that doesn't happen and you're still stuck and you're still feeling that you don't have a direction or options, then that's an area that you can look at. And this is no surprise, because when we talk about self-esteem and a positive view of yourself and understanding your strengths, this is very much related to your self-esteem. And we know all the research that talks about how you feel about yourself, and if you're aware of your strengths and how you pursue and develop them, is a huge factor towards resilience, because you're focused on the, I don't want to say the positives, but you're focused on the strengths versus the deficits of yourself and that. So if you think of Eeyore and Tigger, Tigger is always happy, bouncy, right? Tigger's always happy. That's like my dog Kai. He's like a doofus. It doesn't matter what happens. He's going to enjoy life. It's like, yeah, carpe diem. That's his philosophy, right? And so personalities are different. Very important. Skills in communication and problem solving. We hear that all the time. What does that mean? In a nutshell, it means you have the capacity and ability to ask for what you need. Many people say, I'm a very skilled communicator. And we tend to think we are because we speak English. So we think that transfers, there's some sort of transferability, right? But when you can ask for what it is you need, those are signs of good skills in communication. So we think that that's easy. But how many of you, when you're having a difficult or challenging time, will actually say to someone in your close circle of friends, you know what, I'm upset about this. This doesn't make sense to me. You know, I'm doing this because it's the phone. Most people I talk to are on the phone. And that, often. So it's being able to ask for insight. It's being able to talk to someone. That's really key. And so if you don't have that in your life, it's important to establish that. I remember Crocodile Dundee. Remember, he was walking around in Australia, and he's talking to animals, and he comes to New York, and he goes, no wonder you all need psychiatrists. You have no friends. I just do a walkabout. And he goes and he walked, and he talked with nature, and and he found a way to work it through. So I talk to my dogs, I will admit it. They're great listeners, and they're non-judgmental. And they always still stay, right? But sometimes I know a lot of people who they need to hear themselves talk, and then they can make sense. Some people journal. It's whatever works for you, right? It's different for everyone. And then, and of course, problem solving, which comes back to being able to meet your goals, right? You want to be in the College of Nursing. What do you have to do that pre-professional year and your marks, and then working towards that? Now, when we look at the research with suicide, and we look at that, there's a lot of literature that talks about emotional regulation, but basically being able to handle those raw emotions and impulses. And this is really important when you think about the brain. The brain is not done growing, developing until you're 24, the frontal lobe, right? So when we think about suicide risks and attempts and people having those thoughts and behaviors, their brain isn't done growing, developing. So they're not in the place to make the healthiest choice. But if we can start to teach people that emotions are your body's best friend. Your emotions are only concerned about your experience in your environment. They come through your senses, and they're giving you information about your environment. So when you feel comfortable and light and fluffy, you know that feeling when you're just happy? Feels nice, right? You're getting information. This is a safe place. I feel good here. On the other hand, when you have those emotions where it's just a feeling of you just feel uncomfortable, it just feels, I just don't feel safe here. That's your body giving you information. So your emotions are your best friend, your body's best friend. And it has your survival at utmost. That's the agenda. Your whole brain is wired for your personal survival. That's why we have the fight-flight response. It's geared to protect you from danger. The problem happens when a lot of people are experiencing things that are uncomfortable emotionally, and they haven't had the role modeling, and they haven't been taught the skills of how to manage it. It's scary. And many people tell me when they come into private practice, I'm so afraid if I start talking about everything that I just will not be able to stop, and I will fall apart, and I'll never be able to put myself together again. So this is not something that's just common to children and youth and teenagers. This is something that's common across the lifespan. So if you look at these, and I hope by now you've rated yourself on all your skills and where you sit, and then if you use our university literal descriptors, we'd want to be 90 and above to have the highest exceptional. Where would you fall? Because then that tells you where you are doing well and where you can make steps for improvement. Now, I spent a lot of time on this because it's key. And it was interesting with Harvard, they did this business review with businesses. And actually, when they're looking at jobs and employment, they're actually not only looking at a person's educational background, they're actually looking at assessing resilience, because they find resilient employees are more productive, less burnout, and they tend to have less attrition. So resilience is something that they're studying more with job interviews, which is really interesting, right? And what they found in some of the main findings were these three things, in addition to what the APA talks about, but the acceptance of reality. Not looking through rose-colored glasses, right? When we look through rose-colored glasses, we only see what's pretty and beautiful. We don't see the big picture. So it's important that we see all of it, so that we see reality. Construct meaning, find purpose, and ability to improvise. So they talked to Viktor Frankl, who was a psychiatrist, and he was a POW. And they asked him and other survivors of concentration camps, who was it who made it through, the optimists or the pessimists? What do you think? The pessimists. Because they had a realistic appraisal of the situation. They weren't thinking, we're going to be rescued at Christmas, we're going to be rescued at Easter, we're going to be rescued whatever day. They saw, this is the reality, this is here, I don't know how I'm going to get out. So Viktor Frankl actually said he thought about the lectures he was going to give after. That was one of the things he did, and he developed the theory of existentialist, and that which we talk a lot about. So it's that ability to construct meaning. What's the meaning? How can I get through this? And the ability to improvise. So when we look at that, we can call it cognitive flexibility. We can call it any number of things, thinking differently. And again, the APA just talks about just some very simple things, knowing that change is a part of life. And really, nothing there I think is too new. Take care of yourself. How often do we hear that? But do we really know how to do that? So who can improve their resilience? And the answer, we've already answered that, is anyone and everyone. So can children. We can teach these to little people, right? They can learn these things. And why would we want to know about resilience? And why would we want to practice factors and things that can help and assist with ours and with others? Because it improves the quality of life, improves our ability to enjoy life, and that's what life is to be about, is to enjoy the life. The good along with the not so good, right? So it's important. So it basically, and the other thing about it is when we improve our own resilience, we provide better care to everybody who comes into contact with us, because then we know how to foster it. We know that how I interact, my relationship with this person is key. If they do not have positive support in their own life, when they come to me as a healthcare professional or in any capacity, and if I am that supportive person who is respectful and collaborative and all those things we talk about in trauma-informed practice, then I can actually be of some assistance and mitigate some of the adversity that they're facing. Where to start? So where to start is we need to know what, in fact, impacts our resilience. What is it that can make it more difficult for some people than others? And this is where it's really important that you have knowledge of your own personal history, because this is different for everyone. If you're Indigenous, it has a different history. If you're non-Indigenous, we look at other people who come from other countries and have had other experiences before they come to Canada. So it's important that we look at that, because the past does impact the present. It does impact who we are, who we've learned, how we've learned to be, and how we've learned to perceive the world, and that. And I do want to bring your attention, adverse childhood experiences. Probably most of you have heard of this, but it's just important that we know that it's the longest longitudinal study done to date that has looked at the impact of adverse childhood experiences on health later in life. And what's really interesting about this was it looked at personal experiences of abuse and neglect, but it also looked at witnessing intimate partner violence. It looked at living with someone who had a mental health condition. It looked at incarceration. So not only what happened to you directly, but also in your home. What's really interesting is the vast majority of participants in this study were Caucasian. This study was done in California. We had 17,000 individuals. And there was a small part, like I think it was like minor, like 2% who might be Indigenous in there, but they didn't actually have that to be able to self-declare. So when you look at that, we found that adverse child experiences are very common. So this is important when we think about resilience. We think about why people cope well, so why some people cope better than others, is many people have had adverse childhood experiences, Indigenous, non-Indigenous, worldwide. And what they found, so this is a primary Caucasian demographic, is 28%, that's almost 30% that experienced physical abuse. So this was all before the age of 18. And 21% sexual abuse, that's 1 in 5, and we're looking at a Caucasian middle class demographics, right? And those who had clusters, meaning more, so 40% had more than 2, and 12.5 had more than 4. So 4 is the big number where we start to see those changes that we're really concerned about. So it has a dose relationship. The more of those adverse ASIF experiences you have as a child, it's correlated with more health problems. And so there's this stunning link. So we're looking at lung cancer, diabetes, autoimmune diseases, depression, violence, being a victim of violence, and suicide. So if you have a score of 4, it starts to get serious. So look at that. Let's look at one like depression, 460% increase. Attempted suicide, 1,200. So it is significant. And more recently, there was an article in 2017 that talked if your ACE was 6 or more, 24 times increase the odds of attempting suicide. So this is significant when we look at programming, when we look at policy, and we look at how can we make a difference, and we look at upstream programming, is to prevent this from happening, which is the goal, right? And to be aware of resilience, to know that even though people go through these negative experiences, what can we do to help them cope in that? And we can't talk about resilience without getting into trauma. And I just want to say it's traumatic. Trauma is relative. To an 18-month-old toddler who falls and scrapes their knee, the first time they've felt that pain is the most painful experience they've had, and it's incredibly traumatic because they don't know what's happening. And so it's relative based on what you've had and what you've been through. But anytime someone is overwhelmed and they don't know how to cope with what's happened to them, it's traumatic. I just want to draw your attention that it is more detrimental the younger you are. Lots of research to substantiate that. Dr. Bruce Perry has done extensive workshops, writing publications, books, and articles talking about the neurodevelopmental impact of trauma and how it affects the brain and the pruning and whatnot. So what we do know, now these are Canadian statistics, is it's very common, very, very common. And we look at 76% of Canadians have had some type, 9.2 meet the criteria for PTSD. So this is Canadians. This is not specific to Indigenous or non-Indigenous. And that's higher than what the DSM talks about PTSD, right? So lots of trauma. So what happens when you're in situations, you get the fight-flight response activated, right? And short term, it's meant to help your body survive, to get you ready to run away or to fight. And it's about your survival. So this response is meant to turn on when there's danger, and it's meant to turn off when the danger is over. But what happens is when the danger is always there, is it doesn't get turned off the same way. And you have those elevated levels of cortisol and then the ensuing glucocorticoids, then you have those resulting diseases and chronic conditions that develop. So it is imperative that we look at experiences and trauma, what's happening. This is just a kind of a good diagram. A healthy central nervous system flows like this. We wouldn't want to be flat because that's like numb, right? But we want these gentle waves. But when a central nervous system has been exposed to some of these traumatic experiences, it can be stuck on or stuck off. So we all know people like that when they're stuck on, they can't sit still. They're always looking around, that hypervigilance. They could be having panic attacks. They just go, go, go. They're stuck on. So we look at that, that's like the sympathetic nervous system, pedal to the metal. The other side is stuck off, is it's just lethargic, can't get out of bed, depression, right? You can see both sides of that with trauma. So I just want to draw that to your attention, that it does affect the body. It's not in your head when you've had an adverse event happen, particularly if it's been traumatic, that you don't feel the same. So that's why we're having this conversation, is that there is physiology that changes in your body. There are brain structures that change as well. So, and PTSD. Indigenous peoples have, so when we look at ACEs in general, and you look at where your score would be, if you were to do it out of 10, and then you look at Indigenous peoples have ACEs because they're like all other peoples, and then you take the history of colonization into consideration, it becomes very problematic in terms of increased. So it's just really, in a nutshell, colonization was really about that disconnection from every aspect of themselves. So when we look at mitigating, it's about connection. And relationships are about connection, right? Healthy relationship with yourself, you can have healthy relationships with others. Epidemics, it's just important to know that that was really the beginning of the disconnection and disbanding of the family structure. Many people point to the residential schools, but it actually started with the epidemics. And then that was really, we lost 90 to 95% of Indigenous peoples died within 2 generations, so that's genocide. Residential schools, the 60s scoop. And so really Indigenous peoples have had a variety of responses that have been pathologized for the most part. And it comes from a context of trying to understand what we see in that. So we've become very familiar with the terminology of historic trauma, intergenerational trauma, lots about PTSD. And of course, we're all hearing about the increased mental health and health challenges, all part of it. And the historic trauma. Intergenerational grief. So basically, everyone here has baggage, right? We all have baggage, doesn't matter who we are. When I was taking my ethics class doing my PhD, the psychologist, she said, there's 3 types of psychologists. Which one are you? So I'm thinking, I'm going to be the best psychologist, so I'm going to pick the best of the 3, right? So the first thing she says is a psychologist who has issues. And I'm like, well, that doesn't sound very good. I'm not going to put my hand up. The second one is a psychologist who has issues and knows they have issues. And I'm thinking, oh, okay. And the third one is a psychologist who has issues, knows they have issues, and is addressing them. Meaning that everybody, we all have stuff to work through, and it's really that we have to take those steps, right? So just because you're a psychologist doesn't mean that you have all the answers. Just because you're a medical doctor doesn't mean that you're never going to get sick. It does mean you have more tools and a skill set to circumvent that, mitigate that, right? And internalized oppression. And this is just when people start to believe the messages, what they have heard about, said to them directly, or heard about their peoples or their specific group. And that's really powerful when we look at self-esteem and appraisal of self, as if you believe those negative stereotypes that you've heard and that have been spoken. So this is something that is important to address. So when do we start addressing our resilience? And this is Cree for Saymak, means right now. And is right now so that we can get into enjoying, life. Life is meant to be an experience of our senses, right? It's not good, bad, or indifferent, but it's an experience. And I think joy is really what we, ultimately look at. The meaning of life is joy, to be able to experience and feel joy. I just wanted to address this, just like, when do you need help? Because it's something that people are often unsure. It's muddy waters. And I like this. This comes from our USask website, from our Student Counseling Center. And I really like it. Like, if after a month something's happened and you're not able to do what you normally do, you can't, take care of your kids and go to school and your job, then it's important that you talk to someone, start that network of friends. And if you're not able to sleep, and if you find you're starting to medicate, even just melatonin and different things, because there's a change in your behavior. If this is something you've always done and not new, then it's a different lens that we're looking at it. And so really, the how of it is really about understanding how these past experiences can impact the present. And I think that's really how to implement something, is we have to understand, we look at theory, we look at different practices that inform our practice, and knowing that we can learn it. But then also trauma-informed practice. We don't know who's been traumatized to what degree in any meeting or room that we're in, but if we were all to run our meetings, communicate with each other with trauma-informed practice, it would make a more peaceful gathering, because we would be mindful of how we're treating people all the time. And that's everyone doing it, not just some people. So the guide that I'm talking about was developed in BC. It's Canadian as well, so that I try to use Canadian in that, but it's been very well laid out, very concrete, very simple. So it just takes in consideration there's many forms of violence in our community and that people respond differently to trauma. And that it's really important that we emphasize safety and control and choices. So if you're wondering how you're treating people, how you're interacting with people, and if those three words aren't at the forefront, then it gives you an opportunity to reevaluate practice. So trauma awareness, and we have many opportunities, in academia, there's lots of workshops and ongoing, is to really just understand that it's not in people's head. That's why I talked about the pathophysiology just very briefly. And that it affects developmental babies. I mean, we look at failure to thrive, babies who are born and don't have that attachment with another person. It's the saddest thing I've ever seen in my life. I saw that in my pediatric rotation when I was a student nurse, and I think it's the reason I never worked peds, because it broke my heart. We're wired to connect. We're born with this actual physical need to connect with people. And without that, babies will quit eating, and they'll lose weight, and they'll actually die. And that, so we're wired to connect. So it's figuring out how can we do this in a healthy way. Emphasis on safety and trustworthy. So this is really important that we examine power relationships. Whenever you're in a position of authority, you're a registered nurse, you're a physician, or you have a title and the person in front of you doesn't have that equal title, there's a power differential. And it's really important that we examine that. So my mother just had surgery last week, and she's still in the hospital. And in a pre-assessment, they talked about epidural, and she didn't want one. But the morning we went, they were pressuring her. The resident comes in, we really think you should have this, and going on, and the anesthesiologist comes in. And I can see my mother she's starting to just give up her stance. But I can see that look of helplessness, kind of glazed over eyes of, okay, they're not going to stop. So I just looked at them, I said, could you give us a minute alone, please? And they kind of looked at me a little like, oh, a little by surprise. But they laughed, they were very polite. And I just said to my mom, I said, what do you want to do? So she's had a fractured L1, L2. She's got severe osteoporosis. She's lost 6 inches of her height. Like her back is spinal cord, severely been severely compromised. And she says, I don't want the epidural. And I said to her, do you want to tell them that, or do you want me to tell them that? She goes, they're not listening to me. I'm shaking my head, and they're still telling me why I should have it. I said, okay. So they came back, and then I told them, I said, she doesn't want the epidural. And then I told the surgeon, I reminded him she does not want the epidural. And then when the nurse came to take her away, she does not want the epidural. So our role as healthcare providers is to impart information, to make sure there's informed consent, but ultimately let people make decisions. Duran and Duran talk about this mistrust. It's the greatest barrier for healthcare professionals and people who work with Indigenous peoples. They say that this is actually a sign of resilience, mistrust. Because what would that say about a group of people if they continue to trust another group of people who have not had their best interests at the forefront? So look at this as a sign of resilience, as a sign of they're saying, hey, I'm not sure if I want this. And so it's really important. Often we have people coming in, like how do you treat people when they come for sessions? How have you been treated when you've been late? Say something happened, you had a flat tire or something happened, and you're 10 minutes late and the person is just really annoyed with you. How does that make you feel? How safe do you feel in the relationship? I remember when I love Pelican Arrows. I went back to nurse there 3 times, and I always did the prenatal program. And the moms would come, and sometimes they're on time, and sometimes they weren't. And the way I consistently greeted them is, how nice to see you. I'm so glad you came today. How have you been? It wasn't, I had you scheduled 10 minutes ago. You see the difference? So we're looking at power dynamics. We're looking at people who've been with the residential school, who've been institutionalized, who've been told how to think and what to do and how to act. And when we're looking at empowerment and we're looking at resilience, there has to be choice. And even though we have all the information we think we do as healthcare professionals and whatnot, ultimately that person is the expert of their life and they know what's best for them, right? And so we really have to honor that in terms of safety and trustworthiness. And that, as I've mentioned, opportunity for choice, collaboration, and connection. And just remember that as uncomfortable as it may be for you, for someone to express their emotions, it's really important that they are allowed to do that, that it's facilitated. So it's really important that we become comfortable with our emotions, right? So if I'm not comfortable with my emotions, I am not going to be comfortable with someone else's emotions. So, and this may sound really elementary, it may sound like, oh, I know all that. And then my question would be to you is, do you actually do that? Do you do that in your practice? Do you actually relate to people in that way where it's okay for them to be them and that? So it's just when we look at the fact that many people do not have an ideal family, which none of us do, to get a 10 out of 10 for completely supportive relationships, that means many people are relying on outside the family. And that could be any one of us in this room. So if we understand how important this is and what a difference it can make, then we know we're enhancing their resilience as well, right? And of course, it's always about focusing on the strengths and what individuals are doing well. So it's noticing, it's paying attention to what they're doing well. I'll never forget, it was so humbling for me. I was involved 5 years at the OASIS program, which is on 20th Street at the Westside Community Clinic. And I did individual counseling for women whose children were often in care and in the process of getting them back. And it was a huge snowstorm. This was a couple of years ago. And I was late. I was 10 minutes late. I had a vehicle. I was 10 minutes late getting up. It's by St. Paul's Hospital. And I walk in thinking, like, no one will show anyhow. And this mother is there with 6 children. She beat me. I said to her, I mean, I'm caught. I have a vehicle. I'm late. I was like, what's wrong with me? And so I just looked at her and I said, how did you do that? Like, you beat me. And so she started to tell me how she went through a process to make sure she and her 6 kids got there on time because it was important to her. She values the trauma work we're doing. And I just said, you inspire me. I have a vehicle and I was late. You know, just that human component of acknowledging the strengths and how much people go through to get to appointments and how, you know, it is not as easy as it is for many of us. And that we cannot increase people's resilience when we lose our cool. So there's this one psychologist, John Ebert, he talks about when you flip your lid. So if you think of this as your frontal lobe, this is where the fight-flight response is in the old part of the brain, the brainstem. Covered and protected. So this is a symbol of your brain you can take everywhere with you, right? So when the fight-flight response has been activated, this is what happens, right? It's just on fire. Everything's kicked in, hypopituitary adrenal axis, you flipped your lid. So he shared the story. I did that to my wife once. She was losing her cool, and I went like that. He goes, don't do that. He says, may I bring it to your attention? He says, didn't go well. So when we as practitioners are losing our cool, that is not role modeling, it's not calming, and it's not using the best opportunity we have with clients. If we can't stay calm, and it's not even happening to us, may I remind you, they're the one who's either bleeding in front of us or having some sort of crisis. If we can't role model appropriate, regulated, emotional behavior, then we've lost an opportunity to impact our clients. And that, so I think of that, you know, flipping your lid. So when he teaches emotional regulation, he talks about learn your symptoms when it's starting to get here, when you're starting to lose your cool, so that you can bring it back down, right? So it's just something to think about, and it works really well when you're describing it to patients and to children. Little kids like that. They're like, right here, Mom. I'm going to lose it. You know? So it's just those things that it's really important that we understand the impact of how we are in our relationships and how we can understand ourselves and why we act the way we act. Of course, this needs changes in our treatment culture, and we have to be aware of things that are problematic and challenging, you know, vicarious burnout and vicarious trauma and staff burnout. And if we're triggered by our clients, that's your body's signal saying you need to heal. It's a gift. If you look at it, it's a gift. Your body's telling you there's something that's unresolved in there. So when people have triggers, and often when I show the ACE, I tell people, if you get triggered by this, that's your body's way of saying, hey, I need some help here. In that. So it's just a healthy way to frame it and not to, ooh, she's triggered, you know, and walk away. It's understanding where that comes from and to help people to destigmatize it. So really, the goal is we have to know what impacts our relationships, our own personal histories, and people we work with, so that we can have healthy relationships, because that's the number one when we look at resilience, is healthy relationships in the family and outside the family, and we can be a big part of that. I want to go back to that first slide. Any questions? I left some time, a little bit, for a discussion, because I want to bring you back to resilience, to remind you the whole reason. So primary factor is having caring and supportive relationships within and outside the family. So when we wonder how we can make a difference, that's really key. And relationships that create love and trust. So trust is part of trauma-informed practice. Positive role models. So when people come in and they're really challenged with what's going on, do we walk through with them and help them in a way to facilitate problem solving, knowing that when we teach someone problem solving steps, that they can do this over and over by themselves, that we've just improved or enhanced their resilience. So it's a really simplistic, concrete way to look at it, but I want you to really think about, what are you doing well? Yes? Well, if you looked at kindergarten, what's the rule you learn in kindergarten? Do unto others as you've had others do unto you. That's a biblical one. I think it's the other way. And really, we see this in many ways, but I think trauma-informed practice has really made it concrete of a format that we can all follow. I'd say there's many philosophies that have this, different types of faith, spirituality. Baha'i is one that comes to mind really quick in that. I would say when you're looking at dog training, when you're looking at practices, it has moved away from punishment. Remember, we used to be very punishment-oriented. And even with athletes, it used to be punishment, train harder, push harder. And it's changing now to looking at positive psychology and looking at the body and intensity and understanding how muscles fire and work. I would say that we're seeing probably a global change. But do people actually know perhaps what they're doing? No. When we talk about healthy communication, really, if we were to follow principles of healthy communication, it would very much be in line with this, keeping relationships intact. And not that we don't always, once in a while, do this, right?
I was going to put up my hand, but I'm scared to.
Okay, so my question is, can you speak a little bit about what resources are available maybe here on campus for some of us?
Resources, that's always a question I get. Well, first of all, we have our mental health. We have our student center, right? And they provide mental health counseling there. That's probably the most formal place. We have our informal, when you look at the Gordon Oaks for Indigenous students, and they have the gatherings and the elders coming and whatnot. And then if you look in the city of Saskatoon for free counseling, adult community mental health, which is, you call City Hospital, the intake, and the NAW is beside there. They have child and youth and adult. It's free counseling. Then you have various sliding scales with different organizations. Then, of course, private. The good news is if you're a treaty or you've been directly impacted by the residential school legacy or the 60s scoop, and a family member of missing, murdered Indigenous women, is non-insured health benefits for Canada will pay for your counseling. There is a list of non-insured health benefits therapists that you can get by going on the website, and you can access services that way. Another way is victim services. I've had clients through there, is when they've went through the judicial system and they go through victim services, they actually allot a certain amount of money that will pay for private counseling, but it will also pay for cultural events, which I was pleasantly surprised. So they could go to a sweat, or they could do something traditional in their own culture, which I thought was really progressive in that. So I think the key foundation is start talking to people who are connected and where they're going to, if what you're doing isn't working. Yes, Caroline?
So can you talk about the relationship between resilience and forgiveness? And, you know, because within, I know a lot of the work that I've done, life history work, is that relationships, but also, like, not only not only what happened in residential schools, but also what happens between people in communities, in homes, and so what is that relationship between resilience and forgiveness, and how do people reconcile forgiveness as part of their journey?
That's a really good question, and I'm probably not the best Western psychologist to ask about that because I've been down that path myself. For me, forgiveness in the textbook or the religious perspective never really made sense for me because it felt passive. It felt if I forgive you, it felt like I'm accepting it, right? And I heard this psychologist, he was on Oprah, and I can't remember his name, but he came to Saskatoon. And I loved his analogy of forgiveness. It's the same thing of letting go, because forgiveness is basically taking those hooks out of your back, those past experiences that drag you down. They're always kind of there, and when you're feeling down, they hurt more. And what he did was he started touring jails. He'd been a psychologist for 30 years, and he says, I've got this case, I've got all this knowledge. And he talked about forgiveness in the contemporary kind of way that we think about it, just let it go, you know. And he said they threw food at him. So he went back to the drawing board, and he came back with this concept. And I use this with myself, and I use it with 90% of my clients prefer this. He said, forgiveness is hard for most of us. But I want to ask you if you're interested in revenge. He said all the inmates, their ears perked up, just like you all just did. And he said, revenge in this context. Revenge is live well despite what's been done to you. So he said one man came into his practice and he said, my father used to beat me every day. How do I forgive him? How do I forgive that? He says, you get revenge. You be a different father. You don't beat your son. Revenge is a verb. I'm doing something. I am taking control. And I'm going to live well despite. So maybe someone intentionally or unintentionally hurt my feelings. If they unintentionally hurt my feelings, then I'm not walking around thinking, man, I don't know why they said that, and, you know, going through that whole thing. And if they intentionally tried to, you know, the most powerful thing is to be happy despite. I had one client who was working like at a McDonald's type thing, and she said, my supervisor is harassing me, and she's bullying me, and I'm just so angry. I don't know what to do. I said, do you want some revenge? She looks at me, she goes, yes. And I said, you be so nice to her. Doesn't matter what she says, you smile at her, and you walk away, and you do it. She goes, well, what is that going to prove? I says, you're basically doing this to her. You don't matter. You're not going to affect my day. And she says, I don't know that'll work. I says, try it for a week. Come back and tell me next week. She came back, and she said she lasted 3 days being a wicked biatch. And then all of a sudden she changed because she lost her power over that person. So when you think of revenge, of living well despite, people lose their power who are bullies. If people are intentionally trying to hurt you and you're still happy and you go forward, it's like, I obviously can't impact her or pull her down. They give up. And plus I feel empowered. No matter what has happened to me in my past, I'm going to live well. That's my revenge. So I like that better than forgiveness, because that works for me. Was that helpful? Yes. Thank you. So I'm actually thinking revenge. Not forgiveness. So I have to forgive, right? Because to me, my chest actually feels like it collapses when I think forgiveness. And you should see clients when they're sitting with you and people are already depressed, sit like this. Very shallow breathing. You talk about forgiveness, this is what happens. You talk about revenge, this is what happens. It's interesting watching the body.
I'll just add, because I know this gentleman has a question, but one of the things that bothered me back a few years ago around what happened in Hollow Water. So Hollow Water is a very interesting community which they had high rates of sexual abuse, and then the women basically went into the bush and decided enough was enough and came out, and the community transformed from having these high rates to having and they did it through restorative justice. And it's a wonderful story and a wonderful model. The only thing that bothered me was around the pressure placed on victims to forgive. And I remember talking to Joe Couture about it and saying, I have a problem with the idea that you're compelled to And that could simply be that I didn't understand because I wasn't there, so I didn't understand. But that's always kind of stuck with me around, this question of resilience and forgiveness. And especially when there's community pressure around community processes that are good for the collective, but then place that on the person to forgive.
Spiritually, I don't believe I have the authority to forgive Cindy's behavior. Who am I to forgive her for her behavior? So that bothers me as well. All I can do is live my life, because then we're going back into a very, like a religious perspective. I forgive you, right? I believe that, and I'm saying Cindy because we're good friends, I'm not picking on her, is that we all have our own karma and we answer for what we do. It's not up to me to say I forgive you, but what I can do is have my revenge in the sense of I leave her alone to make her own peace, but that's not part of my peace. Because it's not okay that you hurt me and you did this and that. It's not okay for me. So I can't forgive in that sense of saying it's okay that you bashed me over the head and dragged me down the street. There's no way I can say that because my body rejects that, and it's just not my truth. So I saw him on Oprah, and he came to Saskatoon, and I went to the day workshop, and he was amazing. He was amazing. A lot of his strategies were very unorthodox, and he was a Caucasian, older male, and he was amazing. He was 82. Yes? So do you think
spiritual practice will have a positive impact on the resilience?
For all people?
Or for some people.
The reason I clarify that, will spiritual practice have an impact for all people, he's saying. And when we look at indigenization, and we look at TRC calls to action, and we look at incorporating and integrating other worldviews, when you start to look at non-Eurocentric Western paradigms, most of them, Japanese, Chinese, Indigenous, they have a holistic perspective of the body and wellness that includes spiritual. Now, spiritual, for many people, after the Cartesian split, there was a mind and body split. So the root word of psychology means study of soul. How many psychologists, counselors actually talk about the soul? Not many. We're considered woo-woo psychologists out there, right? And spirit, right? But spirit really is about understanding, from my perspective, it's about the interconnectedness of this whole universe. Understanding that just because it's like an energy, and understanding that there's life beyond my body and that I'm connected to that life. So in Cree, a rock is animate, meaning it's alive. So the Cree language is structured where animate and inanimate, so it's either alive or dead, not like with our pronouns and that. So if you think about it, emotions have energy. You could say that's the psychological, emotional, but you could also say that's the spirit of the energy. Words have energy, which is the spirit. We could talk a lot. Dr. Emoto's research is where I'd go with that. He's a Japanese scientist who studied the impact of words on freezing ice crystals, and why that's important is because 70% of our body is water. So words do actually impact us.
So you mean the answer is
yes?
On that note, thank you all for your questions, and thank you for coming, and thank you to Holly for sharing with us as well.
Thank you.
And we've got a class that's waiting to come in. So if you're a student, we are hosting a lunch with Dr. Graham and Dr. Tate back at the Saskatchewan Indigenous Mentorship Network's office. So you're welcome to join us for lunch. We're going to head back there right away. So follow us. Thanks.
I like that answer. Yes.